Glaucoma is a condition where the optic nerves, the cables which take the messages from the eye to the brain, get damaged over time, eventually leading to a loss of vision. Age is the most common risk factor. So above the age of 40, 1 in 50 people have the most common form of glaucoma, and this rises to 1 in 20 above the age of 80. Another risk factor is having a close relative, such as a brother, sister, or parent with glaucoma, which is thought to increase your risk fourfold. Certain ethnic groups are also at more risk of the most common primary open-angle glaucoma. For example, African Caribbean people have a 4 times increased risk compared to their European counterparts. Medical conditions such as diabetes, which are felt to increase the risk of glaucoma. Glaucoma is a condition that has relatively few symptoms early on in the condition, but if unchecked or unmanaged, then later on the patient will start experiencing the effects of sight loss. In the past, often the analogy of having tunnel vision was used, which is a poor analogy because most patients don't see black bits in the vision. More likely, they will be aware of blurry patches if the disease is quite advanced, or really what they'll become aware of is the consequences of the sight loss. For example, they might miss curbs, they might bump into things, struggle to drive. Things that make a day-to-day difference to their quality of life will become more difficult. This is usually quite late on in the disease, and ideally we'd be looking to pick it up at a much earlier stage before a person notices the actual symptoms. There are some other types of glaucoma which present with symptoms. For example, the angle closure type of glaucoma, a patient may develop a very painful, red, blurry eye. The pain can be so severe that they feel sick with it. And this can be quite dramatic, and in these situations we advise people to seek urgent medical attention. Opticians will assess for glaucoma using a variety of techniques, including measuring the eye pressure, assessing the peripheral field of vision, and also looking at the nerve which gets damaged in glaucoma by either taking a picture of it or performing specialist scans. And if they pick up any risk factors in the patient's history or on any of these tests, they will refer the patient to a specialist service who will do further investigations to decide whether they need treatment or monitored for the condition. If the glaucoma is picked up early on before the patient notices symptoms, there is a good chance of being able to manage the disease, usually by reducing the eye pressure and thereby preventing any significant future sight loss. And in most countries, we can achieve this for 90% of the patients we treat. However, if it is picked up too late or not treated, or sometimes even if it is treated, the patients can still eventually develop sight loss that may impact on their day-to-day quality of life. Thankfully, in the UK, this is relatively rare, provided the patient is picked up early enough to manage the disease. And this constitutes less than 10% of the patients who go on to lose vision in our clinics. So there is nothing specific that someone can do to prevent them getting glaucoma, other than leading a healthy lifestyle and diet, not smoking, and controlling any conditions that they may have, like high blood pressure or diabetes, which all help in maintaining the general health of the eyes. The only way of preventing any significant sight loss from glaucoma is to pick it up early, and therefore our most important recommendation would be to ensure that you see your own optician regularly to have your eyes, health of your eyes assessed. Eye tests are extremely important in detecting glaucoma, as they allow us to pick up the condition well before the person would notice any symptoms. A vast majority of patients we actually see and diagnose with either glaucoma or risk factors that may lead to glaucoma aren't aware of any symptoms because they were picked up by their own optician. There's a common misconception that opticians just prescribe glasses when actually they're an important part of the eye healthcare system and are able to pick up a variety of eye conditions, just as well as glaucoma, at a very early stage.